Good morning, everybody. Thank you for joining us in this debate on a really important subject around mental well-being of our workforce. My name is Dr. Kirkham. I'm a GP in Dorset. I work as the ICS, the Integrated Care System clinical lead in Dorset, and also work as a clinical advisor to the national team in NHSBSA around system development and in population health management. And I'm joined today by two speakers. We have Dr. Emma Vaux and Melanie Maughan, who I will introduce to you now. Unfortunately, Dr. Caroline Taylor couldn't be with us today, and she sends her apologies. Dr. Emma Vaux is a consultant nephrologist and general physician at the Royal Berkshire NHS Foundation Trust. She's a clinical lead of the Berkshire Kidney Unit, clinical director of integrated medicine, and a medical associate director for patient safety at her trust. She's immediate past senior censor and vice president, education and training at the Royal College of Physicians, and is now a chief examiner. She's co-chair of the Academy of Medical Royal Colleges Joint Academy Training Forum, and a Generation Q fellow and founding fellow with the Health Innovation, the Health Foundation. Apologies. Melanie Maughan is the Wellbeing Manager from the NHSBSA, which is an arm's length body to the Department of Health and Social Care. And they have, in addition to providing their usual services to the frontline NHS contractors and member of the public, they stood up a number of services as part of the pandemic response. And since the start of the pandemic, most of the workforce have been home-based, with a number of operational colleagues remaining in the workplace. So welcome to the session, Emma and Melanie. Thank you for joining us and giving up your time this busy morning, busy for everyone. And love to have a discussion with you from a couple of different angles about really frontline workforce and the huge amount of work that also we've seen going on in the background to keep services running. So thank you for joining me. So first of all, to Emma, how is staff morale? How does it feel after the beginning of something that none of us had expected to happen to us? What is it like?
I think you're so right. I think this has been the hardest year that many of us have faced in our careers. But I have to say, I'm so proud of my colleagues. The strength and resilience under intense pressure is like never before. We already had a very stretched workforce before all of this, and I think that there is some real concern that some doctors, and particularly our trainees, whose training has been affected, might step away. An RCP survey has shown us that whilst a fifth of trainees, the pandemic has really reaffirmed their commitment to being a doctor, about a third are questioning this as a career. So we need to work hard to retain our staff. And as a start, I think it's about encouraging time off to try and restore whilst we can.
Thank you, Emma. Really important and really interested in support those trainees for the future. So how do you think this has, in your experience, really impacted on clinicians' mental health and well-being?
So I think that doctors have shown such resilience, and particularly really trauma-faced. I think that's had a huge impact, particularly in the number of deaths that have happened. And we know that from an RCP survey that 1 in 4 doctors have sought mental health support during the pandemic, which, as you know, is pretty much unheard of. Doctors are notorious for not seeking out help and support. And our most recent survey has shown that 2/3 are feeling exhausted, 31% demoralised, and only 57% are not getting enough sleep. So it's a rather desperate picture.
Really, really important, isn't it? Do you think we are doing enough to support colleagues to talk about how they're feeling and to support them in ways that might go beyond what they would normally have done in terms of looking for help rather than being, rather than waiting to the last minute, which is often what clinicians do, isn't it?
So I think if there is one positive thing that's come out, it's perhaps the spotlight on our mental health and well-being. Before the pandemic, the college had already had a real focus on how could we put the spotlight much more on this, because we know that before the pandemic that the prevalence of mental health conditions within doctors is around 17 to 52%. It's quite tricky because doctors don't put their hand up. Most doctors will either try and deal with it alone or within family and not necessarily seek help. But there's something about normalising and identifying it as a strength to ask for help when you need it, that it's much more of a strength than a weakness to do so. And our resource available through the RCP website is about how do we know ourselves better? How can we identify perhaps when we're moving from feeling quite steady, out of balance, languishing to struggling? How do we know when to seek? Where can we get help? And there are some amazing organisations out there, such as Doctors in Distress. And then at the same time, how do we open up the conversation with others? Because often it's that difficult bit. What questions do we ask to open up and normalise it, that this is all okay?
Thank you. I should say to the audience, if you do have questions for our amazing panelists, then please do post them in the chat box. We'll endeavour to come to those questions. Emma, what do you think from your point of view, Melanie, sorry, what do you think from your point of view has been the biggest challenge around the pandemic with regards to supporting those colleagues that are struggling, building on what Emma has said?
I think for us, it's generally been around that blurring of kind of the home life versus work life, and those traditional attitudes that you don't bring your personal life to work. But obviously we know that the pandemic has significantly shifted that, and really being in a place, from a supportive place, where we can address those issues in a really effective way. So it's almost like changing our mindset in terms of actually we don't just support around workplace issues. It's a holistic approach to supporting that person. So we've had to kind of adapt our ways. We've had to do a lot more research around how we can do this in an effective way so that colleagues do really feel supportive. So that's kind of one of the key changes that we've made. It's about we treat those people as a holistic being, and we don't ask them to separate off their lives anymore, because actually it's not practical to do that, especially when with our workforce, a lot are working from home and they do have all of those kind of additional pressures spilling into the workplace. So definitely a more kind of a kind of supportive approach that we've taken. I think the other thing that we've really, really struggled with is kind of trying to balance people's physical health with mental health. We've had a lot of colleagues who've struggled with isolation in terms of lockdown, working from home, wanting to return into the workplace, but actually being able to balance their physical health in terms of risk around COVID, and articulating that to colleagues that actually, we're having to be very careful around how we'll balance those two things, and actually working out what is the greatest risk. And I think, we've been striving so long in the mental health field to kind of give them parity. But then all of a sudden we're seeing actually a physical health actually outweighs this. So that's been quite tricky for us. And again, I think another concern that we're having around colleagues is they're not able to switch off anymore. They have the ability to work from home. We're a very proud organisation. We push a lot of stuff out, but unfortunately that's lent into kind of a lot of behaviours that we don't really want to encourage. We need people to take that annual leave. We need people, because otherwise we are going to see burnout. But again, that temptation's there, and we're becoming that digital kind of 24/7, culture. But it comes with its risks, and obviously we've slightly enabled that because of the pandemic. We've given people the technology, but it's about catching up that conversation where we say, actually, yes, you've got the technology, but actually we don't want you to do that. So that's been difficult. And I think the other thing that we're struggling with as a team, wellbeing and inclusion team, is just the sheer volume of information that's out there. What's appropriate for our colleagues and what isn't so appropriate. And actually not inundating people with information, because I think obviously when people are struggling with their mental health, to bombard people can actually go against what you're trying to achieve. So yeah, a lot of challenges, but all of these challenges, we reflect on that all of the time and kind of adapt our approach, when these kind of things pop up.
It's interesting about the technology side, because I think it's been one of the biggest enablers along the way, but it is also a disabler. And I think that it's about having technology that works for and with us rather than the other way round. And we know that with our huge shift to remote working in terms of with our patients, for example, in the outpatient setting, that about 40% of doctors working in that environment just don't have the right kit or equipment or technology to be able to do it the way that we want, that it wants to be good care. So it's a really interesting one.
Yeah, and the other aspect of that not only is the bombarding of information, this need to keep up with a very fast-paced, fast-moving environment, isn't it? With this, I remember at the beginning of the pandemic, this just like an avalanche of information that we were having to digest, disseminate, sift, think about what was important or not. I mean, that also is quite a pressure on colleagues' minds, isn't it, in terms of both the clinical and the non-clinical aspects of care?
We were quite selective around kind of, obviously we knew that people were dealing with huge volumes of information from the media about what was going on, even just the government guidelines. So we were quite selective about kind of the mental health support that we pushed out there. We were more streamlined, as in this is what you should be going to. It was given, you know, maybe like 5 or 6 different approaches, because actually there's nothing worse than having 5 approaches that no one taps into. As opposed to one where you can focus on it. So I think it was about being mindful, but at the same time being appreciative of actually the support that we were being offered, which was obviously brilliant from kind of the central function.
I think the sheer volume, as you described, of guidance, I think it was not just the guidance coming out, but changing guidance. So particularly about, for example, PPE, just as the very basics at the beginning, was shifting all the time. So lots of confusion, often causing some distress, and just really difficult on how to manage it. And I think with the college and our specialist societies, there was such a strength there in coming together and providing clarity around guidance in what to do in certain circumstances. And that really helped, particularly in the context of lots of ethical decision making that was going on, that by coming together in groups, and I think that was a real strength through the pandemic, you started to get a real sense of communities coming together and how we could work better, and perhaps breaking down some of the boundaries that had been there before.
Great, thank you. So just then moving the conversation into what we might do then to ensure that staff are better supported, either through another wave or actually just because the way we work now is different to the way that we worked before. And as we set upon the reset and recovery, you know, kind of in that way, when we're trying to manage a different problem, a different burgeoning problem, you know, Emma, how do you think that what needs to change so that we feel that our staff are best supported, and what's our leadership role within that?
Well, the fact is that we simply don't have enough staff, which is why I think the pressures on the medical workforce have been so immense through the pandemic. There were swathes of vacancies before all of this, and we just weren't really prepared for the huge demand when the pandemic hit. So what needs to change, and it's not just for another pandemic, but for our changing population health needs, because we know that the over 85s, for example, are doubling from 1.6 million in 2018 to just under 3 million by 2043. So that really changes things, as well as it taking 10 to 14 years to become a consultant. So we need to double medical school places, and we need to double them now. And that's really something that the RCP has been campaigning for, and has published a fully costed blueprint for this to make this happen. And I think we need the government to set out its own plans for how to increase the whole clinical workforce, the clinical workforce as a whole.
Yeah, thank you. Thank you for that. I mean, I think COVID has just shone a light, hasn't it, on the frailty of many of our systems, and the need to really substantially build the workforce to be able to look after the people that we the people that we serve. Melanie, what do you think will be the greatest challenges to come then around, you know, particularly thinking about the home-based working? There's a question or a comment in the chat about with the need for more hybrid work as we go forward, from Matthew Roberts, just stating a comment really that people are desperate to get back to some sort of normality, this isolation that you talked about. What do you think about how we can start to get back to some sort of normality, and what will be the challenges around that?
I think the challenge that we've got is that we're going from a kind of a viewpoint where we didn't necessarily listen to our workforce, and I think what we're going to have to do in terms of hybrid working is listening to what colleagues really want, what's going to support them, and I think that's quite difficult. It's quite a difficult thing to do. But I think from what we're finding in terms of, we've started engaging with a lot of our colleague groups around kind of what the preferred steps are going forward, and actually the majority of our colleagues don't want to return 9 till 5. They want that flexibility. And in the past, that's something we didn't really support for a variety of different reasons around technology, possibly not even having the right management skills to be able to manage home workers. We weren't quite there yet. But what we've learned in the last year is that, you know, home working can be effective. It does support people's work-life balance, but actually we need some kind of hybrid in between. And as an organisation, that's kind of the moves that we're going to be making. And obviously, I think that'll have, you know, massive kind of impact upon colleague well-being, but to give people choice. And I think that's the difference. You know, if you need to be in the office because your mental well-being is better within that place, how can we be flexible enough to support you to be the best you can possibly be? If you want homework, what is that option for you? And just being savvy enough to know how we manage that effectively. But again, our organisation is doing a lot of work around that at the moment to make sure that actually we take this opportunity in a way, almost like it's a fire break in itself, to say, actually, what was happening before, was that working? And actually it wasn't. So can we use this as an opportunity to shape the way that we go forward? So yeah, that's how we're viewing kind of the hybrid working model.
Okay, thank you. And I think much industry around the country and around the world even are starting to have the same conversation around flexible working, more adaptable working, whilst recognising the balance in and out of the office. It's really interesting. We're having this debate from two completely different standpoints within the NHS. One is a very clinical facing role. One is a very much a support management role, isn't it? And how there been some differences between the experiences of the clinical frontline staff and the management. Melanie, do you want to just share some of your thoughts that maybe so much positives, but maybe they are opportunities for the future in the way that we work going forward?
Yeah, and we're very mindful, because obviously we're not clinical, and obviously we know that our clinical colleagues have obviously, you know, been under a huge amount of pressure, but we've experienced some kind of opportunity around kind of the pandemic in terms of our language has changed around colleagues now, which has been really, really positive. And that, again, as I mentioned earlier, we treat people holistically, and that's been a really valued kind of welcome step. And I do think it's going to be beneficial from a wellbeing point of view. But again, at the same time, I'm very mindful that our clinical colleagues aren't in that kind of, you know, in that situation where they've benefited from that. And I think as well, what we've been gifted with in a way is that we've got this shared understanding around mental health now. We've done a lot of work as an organisation prior to this to kind of increase people's literacy around the mental health agenda. And I think we've fared pretty well in terms of people reporting mental ill health because of the work that we've done prior to the pandemic to set that up, so that actually it's okay to say you're not okay, as you know, as a lot of the campaigns talk about. So I think we've done a lot of work in that space to enable those conversations, but I still think there's quite a lot more to kind of to work on around that. But I definitely think for those colleagues who struggled around lived experience around mental health, they struggled to provide that support to colleagues when they were struggling because they didn't have that lived experience. Whereas now we have a lot of our management community who get it. And that's been a radical change for us. So I would like to have had that opportunity from another experience, not a global pandemic. I would have liked us to have came to that naturally. However, you know, it's an opportunity now, and we need to expand upon that and develop those skills. And I think everyone is just more emotionally aware of what they're feeling. And I don't think that's a bad thing going forward.
Well, I think that's a great thing, because I think improving the culture around supporting our workforce in whatever way, you know, has to be an absolutely key thing that we must take forward. I just want to talk, Emma, about a question about how long it will take us to return to whatever the new normal is. Question in the chat about, which exactly asked that question, which is a comment on, you know, how long will it be before we get back to normal, and what does that future hold in terms of will the need decrease? And I mean, I've got my own thoughts, and I'm sure you have on what recovery looks like, but also additionally perhaps how we can embrace the volunteer workforce that has also returned to help us. What do you think about the recovery period and what that looks like?
So I think what our colleagues are telling us is that the recovery period, and what we're looking at is that we're trying to restore staff back to some degree of normality. It's always interesting, what does the new normal look like peri and post-COVID? But it's also the recovery of our activity, particularly in the area of patients with non-COVID related conditions. And those are the patients who are really suffering at the moment. And I think that the sort of estimates from our recent surveys around 18 months, although some people think may take as long as 2 years. I think some people have even estimated it may take up to 5 years to see a fully recovered service. But I think the important thing is that we learn from what has been done before over this last year in terms of what are the positives. And I think that some of those is about layers of bureaucracy, how we've worked together in a more integrated ways, versus actually what were some of the things that aren't quite working. And we know that for example, for our trainees, that they have really suffered. They have worked so hard, they have been extraordinary, but they're the colleagues who've been redeployed, who've had their exams cancelled, who've had their career progression delayed. And this then will impact on training places, availability within the system. And this is then a professional group that's worked so hard, but to some degree is then experiencing detriment to themselves. And by delaying progression to consultants, we're also then delaying more coming through the system. And so consultant-led care, and that really impacts on delivering services such as procedures such as endoscopy, cardiology, surgery, etc. So part of the sort of going forward has got to be about how we prioritise training of these dedicated doctors, how we enable more doctors within the workplace, and that at the same time that we're recognising that to recover the NHS, it is the same people who need to restore as well as deliver the same activities.
Thank you. Can I ask you, we've just got a couple of minutes left, just for some final reflections before I sum up on what you think needs to change, just a couple of top points that you think that to ensure that staff are better supported should we have another wave of the pandemic or some other crisis that hits us. What are the couple of things that you would like to see change quickly?
So from my perspective, I think it's that people need to know they matter and what they do matters. They need to know that they're valued. And it won't surprise you that it really is about the size of the workforce, so that we're doubling our medical school places. We start now, so we're ready by 2040, and that so doctors and other healthcare professionals can safely meet our patients' needs, which are changing. And I think that by learning from reducing layers of bureaucracy, but at the same time, how we enable technology to come alongside us in the best way, we can really make a difference.
Thank you. Melanie?
I think for me, it's just around more of a not what needs to change, what needs to continue from our point of view, as in continuing to listen to people's concerns, responding to that, but again, increasing people's kind of emotional literacy And I think that's actually where it all boils down to. If people know how they're doing, then they know how to respond and they know how to manage it. And to kind of view mental well-being more as development. We're all very keen to talk about how positive, development my careers are, but actually we don't consider mental well-being as a development. And I think it would be nice to change that conversation, that it's not something negative, it's something that's a journey and we'll work on.
Yes, that's strength rather than a weakness.
Yeah, and it's an opportunity, when something goes wrong with your mental health, it's an opportunity to not just return to normal. We don't want to return to normal. We want to go above that. And I think that's what we need to kind of start talking to colleagues about.
That's a great place to end. Thank you both so much for a really rich discussion from two opposite ends of the scale in terms of how we can make things better for the future, turn a crisis really into an opportunity for change. I think what I've heard you say is a real risk to training and future delivery, a real risk of the workforce being overloaded because there is a lack of capacity to learn from our experience that we've all gone through and use that as a learning way for the future. We've heard the importance of clarity, of guidance from professional bodies. We've heard about getting back to the basics, about taking annual leave, making sure you have breaks that are structured, and encouraging that emotional and psychological safety and well-being, and to talk about our problems and make sure that the good support is put in place around all of that. So Emma and Melanie, it's been a pleasure this morning. Ladies and gentlemen, thank you for listening to this debate. I hope it has been helpful for you, and just thanks for all your great work. And
thank you.
Have a lovely day.
Okay. Thank you.
Thank you.